Hey, I'm Dr. Norris Golberg, owner of Koru Chiropractic. Please subscribe to my channel to get more tips weekly on how to get your body moving and feeling better on a daily basis. Today I want to talk to you about sciatica. Sciatica is that burning pain that you're going to get right in the back of your butt. A lot of times it's going to go all the way down to the knee and even past the knee into the foot, okay? Now if it goes all the way to the foot, you may have a disc herniation or a bulge, so you really need to go see a qualified chiropractor like myself. But if you're just getting it in the hip or the hamstrings, a lot of times these stretches can alleviate it just alone, okay? So you're gonna need 3 pieces of equipment here today: a tennis ball, a TheraBand, and I got this at Walmart, like a 3-pack for like 10 bucks, and ideally a foam roller. But you can even make one of these out of just PVC pipe from Walmart, or I should say Home Depot, for like 2 bucks, okay? So the first one I'm gonna show you is actually just gonna be a stretch that you're gonna do standing, okay? So it's gonna be a combination of 3 stretches. The first one I do, suck the belly in, tuck the chin in, and I bend at the hips, right? So all the motion is happening right here. I'm gonna feel a lot of tension down the back of the hamstrings, and I'm really just gonna let my arms hang heavy. The idea is that you don't need to go and bend and touch the floor, okay? This one, you wanna keep your whole back nice and flat, just like this. Now, you can hold it for about 30 seconds, and then when you're done that, you can stand up, and then I'm gonna have you do the same thing, but bend one knee, okay? So the knee that is straight is the side that's gonna be stretched. So right now, I'm actually stretching my right side. Again, hold for 30 seconds. What you're gonna feel is that the tension in the muscles actually, instead of being down the back of the leg, you're gonna feel it, instead of here, you're gonna feel it more in the hip, okay? This is actually stretching your gluteus muscle, gluteus maximus specifically, okay? Now, the next one you wanna do, and this one's a little bit more complicated, you wanna cross your foot over and then lean on that front knee and press your back hip back, and it's usually gonna kinda come out to the side. Now, what I feel is a big, deep stretch down the outside of my leg from my hip joint all the way to my knee, because this one, we're really stretching the IT band as well as the gluteus medius, okay? So let me show you on the other side. Just like this, all right? So again, 30 seconds each side, and that just gets those muscles warmed up. The next one we're gonna do is a Piriformis Stretch. So this is my favorite one here for the sciatic pain. It's a little bit more intricate. What you're gonna do is you're gonna take this band and you're gonna wrap it around your foot, and then hold it out to the side. Like turn your whole leg and let it fall out to the side, and you can even use the band to kind of tug it out further that direction. Now the trick is, don't let your left hip come off the ground here. You need to keep it pressed down and turn the knee out. And right now I'm getting a real deep stretch right in my hip muscles right here, specifically the piriformis muscle. All right, so again, 30 seconds. You can even do a little resistance where you kind of pull the band inwards like this, and then relax, and you'll find that you'll get a little bit more stretch in there. So again, pull the band in, and then let it relax out like that, okay? The next one is gonna be more of a trigger point therapy, and you're gonna use a tennis ball like this, and sit right on the tennis ball, okay? So you get right into those burning tight areas that you feel when the sciatica really flares up. You wanna kind of support your weight with your hands and your other leg, because you're gonna need to find where those tender spots are, and once you find a really tender spot, I actually want you to let your whole body weight sink into it, and make sure you're breathing, all right? So nice deep breaths. Once I find that, take a couple deep breaths, and now I'm feeling really relaxed. That pain's not there anymore, but I bet if I just move just a little bit, yep, there's a little tightness right there. So now I'm hanging out on this spot, and then I can even turn my body and get onto it like this, okay? And that's also what the foam roller is for. You take the foam roller, you just lie right on it. A lot of times I'll cross my leg over like this, and it really tightens the hip up, and you get right on that sore spot right there, okay? And roll back and forth. So again, I'm supporting most of my weight with my arms, and just letting the weight of my legs and my hips sink into that foam roller, and kind of massage it out, kind of turn my body a little bit to the side right here. This is really nice, getting in more into the side of the hip. And then lastly, what I do is I get into right on the side of the hip here, like I'm lying sideways in bed, and I'm gonna roll right on this spot right here, just like this, okay? And you can even get on the front a little bit. A lot of people have very tight hip flexors, and glute medius and IT bands. So when you find this spot, a lot of times people don't even want to stretch this or roll in this area, it gets a little tender. You can, even if it feels really tender and you can't move, just let your whole body weight fall over it and just breathe, okay? This actually gets pretty intense, but what it's gonna do, it's gonna really alleviate all that tension in the muscle, and if that's binding down on that sciatic nerve, you're gonna get a lot of sciatic symptoms and referred pain down the leg. So try those quick tips and tell me how they work.